Is numbness on one side of the body a definitive sign of stroke? Numbness on one side of the body is often a concern for many. It can indeed be a symptom of a stroke, but it is not a definitive sign by itself. A stroke happens when blood flow to a part of the brain is interrupted or reduced. This lack of blood flow prevents brain tissue from receiving the oxygen and nutrients it needs. As a result, various symptoms can arise, including numbness or weakness in the face, arm, or leg, typically affecting one side of the body. However, it is important to remember that numbness can also stem from other conditions. For example, nerve damage, multiple sclerosis, or vitamin deficiencies can lead to similar sensations. So, while numbness can be a red flag, it is not enough to conclude that a stroke is happening without other signs. To assess the possibility of a stroke, healthcare professionals often use a method known as FAST. This acronym stands for face, arms, speech, and time. First, check the person's face. Ask them to smile and see if one side droops. Next, ask them to raise both arms. If one arm drifts downward, that could be concerning. Then ask them to repeat a simple sentence. If their speech is slurred or hard to understand, that is another warning sign. Finally, remember that time is crucial. If you notice any of these symptoms, it is vital to call for emergency medical services right away. If numbness occurs alongside these other symptoms, it could indicate a stroke. However, if it happens alone, it might be due to a different issue. Therefore, if you experience sudden numbness or any other concerning symptoms, seeking medical attention is crucial. In conclusion, while numbness on one side of the body can be a symptom of a stroke, it is not definitive without additional signs. Always consult a healthcare professional for an accurate diagnosis and appropriate treatment.